Years ago in Victorian England, there was, mental institutions. These were institutions and workhouses that were literally used to take people who were genuinely, if you like, struggling with every day-to-day life and put in somewhere that would make sure they were not a problem to themselves or indeed society. And then, of course, they were deemed as cruel and uncaring and all that sort of stuff. But when you think about it now, some people might suggest they should be brought back because, quite frankly, what we're dealing with over here in the United Kingdom is a mass epidemic of serious mental illness where the top echelons of people are simply pandering to them for fear of being called out of being uncaring or unkind. But when I tell you this particular story, you'll understand exactly what I mean. As ever, let me explain. Morning, lovely to see you on this wonderful day here in London town. We'll have a lovely wave. Are you all right? Good morning, good evening. This is going to be apparently the hottest day of the year so far. Yes, well, I don't mind it. As I say, it's free vitamin D, and if you can get out or near a window, do so, because, I know a lot of people suffer with the heat as much as the cold. We're never happy, are we? Vitamin D is good for you. And as I say, it saves you buying the tablets, doesn't it? So you have to think, well, 20 minutes sat outside in a chair with a cup of tea. Ooh, bliss, isn't it? Joining me? Well, yes, I'll join you then if you like, absolutely. Now, what's interesting about this particular story, I find incredible, is this, because when you now go to the hospital, and, I have a lot of respect for doctors and nurses and stuff like that, because they train hard and, they are dedicated, and it's clearly a vocation for many different people. But the people now in charge are literally making them a laughing stock. And it's truly all down to these ludicrous ideas, because now the NHS staff have to ask, get this, if you're doing a scan or an x-ray, are you expecting? Are you pregnant? Not a problem, of course, with females. But if you're a fella, a man, right, now they will get into trouble if they don't do this. And this is all down to inclusivity and, of course, making people feel as one. This is where all the very expensive inclusive managers that you read about, and 100,000 a year, they've come up with this. This is the plot, right? This is why they need such money. But when you think about it, it's absolutely ridiculous. And I was talking to a doctor the other day who said he refuses to do it, but daren't say it, but just doesn't ask the question. It's already made the news over here, and it just got me thinking as to how mad we've all literally become, because this is the minority. This is clearly some kind of mental illness, and it's now being played out literally across our hospitals and the NHS. Now, when you have the new health secretary, Wes Streeting, who has a rather dubious background himself with some very offensive tweets online that have now been exposed about wanting to push people under trains, you can understand exactly what a nutter and why this particular organisation is not going to be any better under this brand new government. But what I find fascinating is, if you're truly working, and it's a vocation and you care about it, how awful for anybody having to be put through that, knowing that you're actually pandering to someone. And more importantly, if you do want to ask them, then really, should you be working in the medical profession? And if you're the patient and somebody asked you that and you think, but I'm a man, wouldn't that worry you if they were doing an operation? Really? I'd love to know what you think. Neil Sean in the very heart of London.